Hi everyone, thank you for joining us this evening or morning or afternoon, wherever you are in the world, for our webinar on the Neuro-Inflammatory Cascade of Concussion. My name is Vanessa Brown and I am the UK Business Development Manager, and tonight we are joined by Dr Erik Reis. Dr Erik Reis has a wealth of clinical knowledge and experience, which I know he can't wait to share with you tonight. He is currently based in the US, but actually will be coming over to the UK early next year. It is so nice to see so many familiar faces joining us tonight and also to see some new faces. If you have any questions throughout the webinar, please just pop them in the chat box on the right-hand side of the screen and we will answer them at the end of the webinar, so just type as we go. This webinar will also be recorded and it will be sent out to everyone who has registered within the next 48 hours. So I'm going to now pass you over to Dr. Erik Reis, who will introduce himself.
Well, thanks for that. I appreciate it. I'm excited to speak today because I think that this topic is something that is not only near and dear to my heart, but it's something that is poorly misunderstood by a lot of medical and alternative medical providers. I think there are a lot of theories and ideas and beliefs that we share and kind of think about with regards to what happens with trauma, with concussions and brain injuries. And over the last 20 to 30 years, we've seen a plethora of new information and knowledge come to the foresight about what truly happens during these events. So I'm grateful that you have spent the next, or will be spending the next hour with me. And I hope to bring value. And I, at the end of the day, I really hope that I'm able to answer some of the questions that you have, but also give you an opportunity to even think of different questions. Because I think that's the best part about science, is that when we answer one thing, we have 3 or 4 more questions as a result of that. And so I hope to shatter some old beliefs. I hope to change your thought processes. And more importantly, I hope to empower you to realize that you have the ability to help patients who may not have been helped by other providers by knowing this information. So what we're going to do is we'll go ahead and go through today's agenda. You can go ahead and feel free to read those. I don't think I need to be putting any more emphasis on any of that stuff. We're going to obviously go through and talk about concussions, post-auto whiplash. These don't just happen with sports injuries, and I'm going to elaborate a bit on that. We're going to discuss what happens during traumatic events. We're going to review some brain anatomy, some neural connections, get you familiar with some of these areas of the brain that become complicated with trauma. And then we're going to discuss the metabolic components that happen with this too. I think that structurally, neurologically, and even metabolically, there are so many different things that happen with these different types of events with trauma. And so understanding each and every one of those factors can significantly impact your ability to help the patients in front of you. We're also going to talk about the gut-brain axis, changes that happen with the blood-brain barrier as a result of trauma. And we're also going to go through why laser is one of the most effective ways to help these patients recover from these different types of trauma. So I want to ask you, before we get into all the educational and didactic information, I want you to ask what your why is. My why is right in front of you. My photo of my lovely wife and my dog. I'm a dog dad, tried and true, at the soul of my heart. And so I've always been involved and interested in the brain and in neuroscience because it's been something that's been near and dear to me. I lost my amazing grandfather to Alzheimer's and cancer in 2014. I've played contact sports most of my life. Hockey and soccer are 2 of the top sports that we know about with impactful head trauma and leading to conversations about CTE, second impact syndrome, these specific types of micro concussions or repeated hits to the head over and over again that may not result in a true concussion, but enough neurological trauma and damage and inflammation to manifest to later changes in the brain down the road. And as I said earlier, I recently got married. And so I want to be around as long as possible to be able to live a life of having 0 regrets, 0 limitations. And I don't want to miss opportunities. And I think a lot of you probably share that same passion as well, not only for yourself, but probably for your patients. And I truly think that some of the up and coming technologies of being able to treat the brain are going to be involving low-level laser therapies. Hence why we're talking about these modalities today. Here we have an amazing sagittal slice of the brain. This beautiful brain is what allows us to think and act, make decisions, and move throughout our environment. Depending on who you talk to, this thing is comprised of 85 to 100 billion neurons. And there are even some researchers who think that there might be up to 200 billion neurons. Realistically, we don't really know for sure. And I don't know if we ever will. Maybe AI and different types of software computing will be able to track that. But one of the amazing things with this is that each neuron has the capacity to form up to 10,000 synapses. And even more impressive is the fact that Purkinje cells in the cerebellum have been calculated to be estimated to be able to connect to 100,000 different connections with one neuron. Now, this brain is beautiful. This brain is packed full of different types of immune cells and neurons, and there are so many components that go into our ability to be able to be aware, to be alert, and to be able to be functional. But the brain is malleable, and this concept was something that has been around since the 1850s, but didn't really truly come to fruition until the 1950s and 60s throughout a term called neuroplasticity. And this beautiful kind of philosophy about understanding the brain is just the fact that your brain can change until the day you die, right? It's what allows you to be able to pick up a new habit or become an expert pickleball player in your 70s or 80s. And there's so many aspects that go into changing the brain. But we have to throw an important caveat in there, and this is for better or for worse, right? This neuroplasticity concept can be something that can be very, very beneficial for us as far as learning and growing and becoming more efficient at a task. But this can also become a problem with propagating pain, with propagating dysfunction, right? Neurons that fire together, wire together. And this is so true with concussions because the brain is gelatinous. And if we took this brain and we laid it onto a table, it would kind of take the formation of the table, it would slowly start to spread out. The inherent capacity of the brain is that it is very structurally resilient, if we want to say, but it's also vulnerable to a point. It's stuck inside a hard, compact shell called your skull, and it's suspended in cerebral spinal fluid. And when the brain has this movement back and forth that occurs with a concussion or with trauma, different neuronal networks become affected. And one of the impactful ways to look at this is, there are a lot of areas of the brain that were really important for us. And one of the things I want to point out right away is just the fact that there are different regions of the brain. So on our screen left, we have this amazing frontal lobe on the left, which moves slowly into the parietal lobe. Right above the cerebellum on the lower right side, we have the occipital lobe, and attached to the cerebellum, we have the brainstem. And what happens during a traumatic event is we have just an excessive amount of shearing forces going back and forth through this this brain and this neural axis. And to make this a little bit clearer for us, I think it makes sense to look at a DTI imaging of the brain. You can see all of these amazing connections, and each one of those little colored pathways is actually a bundle of thousands and thousands of neurons. What happens during this counter-coup movement back and forth, the brain moving inside the skull, you have the shearing of different axons. And one of the most important ones I want you to think about and really digest is the fact that there are a lot of axons that go between different hemispheres, the right and left hemisphere. This corpus callosum is such a thick layer of communication back and forth between the right and left brain. But almost just as important is the communication between the frontal lobe and the cerebellum, the frontal lobe and the brainstem. These projecting ascending and descending fibers that go throughout the brain are so impactful for us. And this is one of the most difficult things for us as providers, is to say, well, we had trauma to this area of the brain, or this system became affected. It's no longer as simple as saying, if we got hit on the left side of the head, oh, we're going to have left-sided brain damage. If that was the case, our jobs would be far easier. Now, the beautiful part of this is that diagnostic imaging can be very beneficial, but as we'll find out, it does have its limitations. And so realizing that there's so many outcomes and options that can happen with a concussion is something that will be very impactful, because it will allow you to critically think through the patients that come before you. And as a result of this, there are so many different components that come as a result of this trauma. One of the most important ones is changes of using energy. And as we know, neurons are very, very dense with mitochondria. And this is one of the beautiful parts about using low-level laser therapy, is that this low-level laser therapy affects the cytochrome C oxidase enzyme, which is the fourth complex of the electron transport chain. This is really the rate-limiting enzyme for production of ATP within the mitochondria. And in vitro and even in vivo experiments have shown that laser therapy can actually positively affect mitochondrial respiration. It can help stabilize different neuronal membranes, which we'll talk about. The sodium-potassium pump that we all take for granted is something where our bodies spend 1/3, and in some situations up to 2/3 of our ATP produced just to maintain the stability of these sodium potassium pumps. Now, this is important for us because with concussions, there's no difference between a concussion and a mild or even a moderate traumatic brain injury. These are the exact same things. And now it may sound cool to think that you may have a concussion if you're an athlete or you're playing sports, but when you start talking about having trauma to the brain, people's perspectives change a little bit. And we don't have to have a loss of normal brain function or a loss of consciousness in order to suffer a brain injury. Now, this force traditionally has been viewed as having trauma or a traumatic event caused to the head, but it can actually result in trauma to the body as well. These shearing forces that we talk about can be transmitted through the neck, through the brainstem, and affect top cortical areas, even though there may not be anything showing up in an MRI or CT. Limitations with that are really important for us because common symptoms from a concussion include headaches, neck pain, dizziness, changes in vision, light and sound sensitivity, changes in cognitive processing. One of the biggest ones is sleep disturbances. And so if you aren't asking your patients about their quality of sleep or how well they're sleeping, you're really missing out on a lot of information because these circadian rhythms are really important for us, especially as we start digging into changes in the hypothalamus, the hypothalamic pituitary adrenal axis, how this affects the production of cortisol, and truly changes the cycles of not only of our hormones, but of our microbiome as well. Now, we would love to think that imaging has all of our problems solved, and imaging is the best thing that you can possibly do for a patient with somebody who's coming in with an immediate traumatic event. But the problem with imaging is that unless you have a tumor or a brain bleed or some congenital venous malformation, imaging isn't really the best option or the best use of our resources for assessing a concussion or brain, especially if we have imaging that's completely within normal. The problem with this is our imaging is very sensitive, but it's not sensitive enough to pick up on diffuse axonal injuries or understanding which areas of the brain have been affected or haven't been affected. As you know, the brain is like a master computer. And so having a concussion is the equivalent of me pouring water on my laptop. I can't tell you which systems are going to work or aren't going to work based off of the vector of the injury. What I have to do is I have to go into my laptop and check every single program, every single system to make sure that it works and it doesn't work. Maybe my Microsoft Word still works, but my go-to window meeting doesn't work anymore. And so now I have to change my software. And this is really important for us because not only do we have hardware issues as evidenced via structural changes, brain bleeds, and tumors, but we can have software issues. And this is really where you can become very effective as a provider, is understanding how the brain works as a whole, how it involves the body, your metabolic systems, your structural systems to make consciousness and awareness. This is really important for us. But interestingly enough, there are a lot of controversies surrounding what a concussion and brain injury is versus post-auto whiplash as well. And this is interesting because 1.7 million people a year sustain a TBI annually. And among all age groups, motor vehicle accidents are the third leading cause of traumatic brain injury. Well, interestingly enough, we know that whiplash-associated disorders are commonly associated with different types of auto accidents. And so here we go, right? What do these patients actually present like? They have all the same signs and symptoms as a post-concussion or a mild traumatic brain injury. Headaches, neck pain, dizziness, nausea, and vomiting. You can take any one of these symptoms and interchange them with classic post-concussion or mild traumatic brain injury symptoms. And they're all on a functional spectrum, right? At the end of the day, the biggest thing that they all share in common is the fact that they all have some sort of structural, neurological, and or metabolic outcome as it relates to the traumatic event. And this is important for us to take into consideration with whiplash associated symptoms as well too, because once again, we see that diagnostic imaging has not really been proven beneficial overall. Now, if we're specifically dealing with a post-auto whiplash, a lot of people will say, well, we're really dealing with the cervical spine. And I would agree with that. But we're no longer living in this dichotomous environment where it's the body and the mind or the body and the brain. Everything has a connection and everything is linked together. And as we'll talk about, the cervical spine has some significant inputs and feedback mechanisms for the brain, especially after traumatic event. So once you run your imaging, MRIs, CTs, you do your ultrasounds, and then there's nothing there, then why are we going back to this? Well, we may not find anything else unless this is a true tumor. So we have to focus our clinical expertise on being able to do individualized structural, neurological, and even metabolic assessments, because this is where we're really going to find that the rubber meets the road with trying to get people to improve following a traumatic event such as a concussion. Classic coup, counter coup, right? The same thing is true for a concussion as it is for a whiplash. At some way, shape, or form, you're going to have different types of vectors, different types of energies being transmitted into the brain, into the body. We're going to have secondary structural effects, neurological effects, and even metabolic effects. What happens? Well, you have to treat all of the above. You have to look at people structurally. You have to understand them neurologically, and even being able to take a look at them nutritionally and saying, what were your inflammation levels like prior to the injury? What are your inflammation levels like afterwards? Can we correlate some of these things from a clinical perspective? Because what we're finding is that it's not just the structural issues that cause pain or changes in hypersensitivity. We're finding that there are central sensitizations that go on with the brain that cause hypersensitivities to pain. These can be in the spinal cord. These can happen within the basal ganglia. These can happen in the periphery with actual tissue changes and promotion of free radicals and increased inflammation levels. So we really have to understand where these really correlate. And this is one of the best parts about using low-level laser therapy, is that we are truly getting to the root cause and some of the root mechanisms as to why some of these issues persist. And it all comes down to the production of energy and mitochondria. Neural tissue are highly concentrated with mitochondria. And as we just discussed, the cytochrome oxidase enzyme is the limiting factor in the production of ATP in the electron transport chain. So using low-level laser can be one of the most efficient ways for us to be able to induce reparative messaging, reparative mechanisms. More importantly too, a lot of these patients are coming in very neurologically fragile, so they can't do much. We can't tell them to undergo hours worth of therapy a day. Many of them are just barely surviving, make it into your clinic. So what can you do as a provider to be able to accelerate this healing process? You can utilize low-level laser as an effective way to change the brain, change the body, and subsequently change the mind. Now, one of the interesting factors that we're really uncovering now is that concussions aren't a single mechanism. They really involve changes in multiple different areas. And now I'm kind of summarizing this in a relatively global view, and there are so many things that can happen, but we really need to understand that one of the biggest factors with persistent symptoms comes from the fact that there are altered sensory changes, and the brain can no longer process sensory information as efficiently as it used to. Now, these three systems, the visual, the vestibular, and the somatosensory systems, are really the three major players in this game. I kind of equate it to this. If you had three friends that went to the same party, you'd expect them to tell you relatively the same story about that party, where the party was at, who was there, kind of food they had, all of those things, right? Well, the brain kind of functions in the same way. The brain is heavily reliant on information from your vestibular system, your visual system, and your somatosensory system. So let me break this down really quick. Our visual systems, right? This is everything outside of what an optometrist will be able to evaluate. This isn't the eyeball, but this is the retina going all the way back into the optic nerve, the optic chiasm, optic tract, into the occipital lobe, even integrating with different brainstem generators. This is all the software that's involved and not the hardware. You go see an optometrist if you have a lens issue, or if you have any type of visual deficiencies that are involved with the actual eyeball itself. But anything outside of that is brain-based and neural-based. And we have to, if we're going to be leading the forefront on treating concussions and brain injuries, we have to understand the complexity of these visual systems, because they all feed into each other. The second friend that you would be considering is your vestibular system, right? This inner ear system that becomes active with elevators and escalators and any types of translation or changes in relation to gravity. The system is really important because it's the first system to actually myelinate in our brain. And there's a reason why babies enjoy moving in the womb. There's a reason why babies like being swooned and coddled. This vestibular system drives so many different developmental systems that are laid on top of it for our neurological stability and development. And last but not least, our somatosensory systems. This is all the muscles and joints that you occupy. And the beauty of this is that you're always fighting gravity on Earth. And so therefore, you're always getting feedback from the Earth. And this is one of the major factors as to why astronauts can't go to space and stay for very long. Is because without that continuous feedback, their brains start changing. Their cognitive processing starts to be affected. And so if you had these three friends go to the same party, we would expect them to tell us relatively the same story about what's going on. But with a concussion, these three friends can go to the same party and they can tell you completely different stories. So we have to ask ourselves, who do we believe? More importantly, what is this doing to the brain and how is this changing motor outputs? One of the leading theories in the research right now is that a lot of these TBI deficits and even motor changes, right? Let's say it's a stroke and you have some sort of change in the frontal lobe. Altered sensory processing may actually be one of the main drivers for altered motor-based processing as well too. There have been significant correlations with changes in cognition, sensory integration, different types of movement, and even memory can result in changes in your sensory processing. So ask yourself, how does this change the way that you treat your patients? If somebody comes in with a motor issue, does that mean it's truly a motor issue? Or could it be mediated through a sensory processing deficit? As we start to dig into a little bit more about these different systems, vestibular signals are so primitive with regards to brain development. The vestibular system is a relatively old system. It's not that well developed. It's relatively fragile in the grand scheme of things. And it's something that we really take for granted until we lose it. And this can distort tactile, proprioceptive, and even visual signals from our body, just as we described. And in some data and in some studies, they've even found that we actually rely on our vestibular signals greater than other sensory signals when it comes to having a disparity in the information being transmitted between these different systems. This is so important for us because as we start digging into this, it's not a one and, it's the yes and all of the above. The eyes are a huge window into the brain. And I think in the medical literature, especially in 2021, we're realizing how impactful understanding eye movements, visual fixation, pursuits, saccades, anti-saccades, all of these simple eye movements that we take for granted, we're understanding how impactful these can really be in being able to assess, diagnose, and even treat trauma, because they are something that we all take for granted until we lose it. But we've been studying the visual system for decades. I mean, this is one of the first things that we actually started doing research in. And the cognitive neuroscience field has been using this for years to try and assess psychological norms, emotional norms. We're understanding the importance of this by looking at how impactful concussions and brain injuries can be to changes in brain functionality. We also know too how heavily impactful trauma can be to the neck. And as we talked about, this proprioceptive feedback, your neck has a ton of sensorimotor real estate essentially in determining and having the brain understand where it's at in space. There's a high density of muscle spindles in the upper cervical spine. And this is why we see a lot of people having issues with this after traumatic events or a concussion. Now, more importantly too, your neck tone can actually skew eye integration. And so to show that, I want you to go ahead and take a second and I want you to put your fingers and palpate the posterior neck muscles that you have right at the base of your skull, right up where the suboccipitals usually are. And what I want you to do is I want you to keep your hands on. I don't want you to move your neck at all. What I want you to do is I want you to move your eyes left, right, forward, up, down as quick as you can, moving back and forth in these plans. I'm going to give you about 5-10 seconds to do this. Okay, I have a question for you. How many of you felt your suboccipitals and your posterior neck muscles change because of you moving your eyes? Probably a lot of you, if not all of you, if you're actually good palpators. So this is so important for us. For the patients that come in with chronic neck pain, chronic tension headaches, and all we're doing is looking at them structurally, and whether it's your choice of injections or a manual therapy or a myofascial release, what if these patients are dealing with visual issues as a consequence of this altered neck pain? Or what if these individuals are dealing with neck pain and altered proprioceptive neck reflexes as a result of changes in their visual integration? It's a yes and conversation. It's not maybe one, maybe the other. All of these have feedback mechanisms for them, and they're really important. But once again, one of the best parts about using low-level laser is that you can treat this. We can treat the neck pain. We can treat some of these outcomes. And what's beautiful with Erchonia is that Erchonia has done the dirty work and put their reputation on the line because they have 18 of the 21 FDA-approved patents for low-level laser. And with the utilization of low-level laser, there was a 45% decrease in visual analog scores with the use of low-level laser therapy for the head and the neck. The best part about this is a lot of these patients are going to come in relatively sensitive. So laying them on their back, having them be seated, they don't have to be moving in order to be able to use these different modalities. And what we're doing is we're treating the local tissue, but we're having secondary neurological and metabolic consequences as a result of that. And as we go through this, you'll start to understand how important nitric oxide production is for that, for blood flow. You'll start to understand how important energy production is just for the neurons and for brain integration. You start to understand too how dampening local inflammatory mediators can be so effective in taking pain away and altering this hypersensitivity. Now, when we have a traumatic event to the brain, essentially what we're talking about these large bundles of neurons. And as we discussed, this coup-counter-coup results in diffuse axonal injury, meaning that there's injury to a bunch of different neurons. We can't always describe exactly where it occurs, right? It's not as easy as a stroke or some sort of infarct or a tumor specifically affecting a bundle of neurons. This can happen anywhere. But more importantly, this can affect long tracts, like corticospinal tracts. This is a really important mechanism for reflexes. Okay, corticopontine mechanisms that go into the cerebellum to alter balance and integration, cognitive thought processes. These dentatorubrothalamocortical responses, which is essentially a cerebellar pact that goes all the way into the brainstem, through the midbrain, through the thalamus, and up to the cortex. These are so important for us to maintain efficiency with thoughts and eye movements and balance and even cognitive processing. And these molecular cascades can cause damage via oxidative stress, changes in blood flow, inflammation. It can cause changes in cellular permeability, which we kind of already discussed, and it can cause mitochondrial swelling. And this reinforces how important the utilization of low-level laser can be, is when we stabilize these different neuronal networks, we can get these mechanisms to improve and to heal. The problem with this specifically is that when you have increased neurological activity in an area of the brain, you should have correlated increased blood flow to that same area to bring more nutrients, different ions like potassium, sodium, chloride. And this is a really good thing. And this is how MRI imaging works, right? So if I want to grab this cup of coffee with my left hand, I know there's going to be some activity in my left cerebellum, my right midbrain, my right thalamus, my right frontal lobe to be able to coordinate this movement. But what happens after a concussion or a brain injury is that cerebral and subcortical blood flow decreases. And so they're no longer coupled, they become inverse, right? If I'm grabbing this cup of coffee with my left hand and this left cerebellar and this right frontal lobe activity starts to activate, the problem after a traumatic event is we have local changes in blood flow that no longer correlate with that. And so you have a buildup of lactic acids, different type of inflammatory mediators. Things no longer jive as well as they used to, and this event becomes a little bit more eventful, right? Patients who tell you they never used to have problems with scrolling screens or being able to walk on their own, handle different types of cognitive processing, these are the patients that become affected, and this is one of the mechanisms why. Cerebral blood flow changes. But once again, low-level laser can be a very effective means to change this mechanism because of the production of nitric oxide. Now, nitric oxide is a very powerful vasodilator, and it's released from binding sites during low-level laser therapies. What happens is you cause an increased diameter of blood vessels, causing increased blood flow. So let's say, for instance, your examination meets and you say, well, maybe we've got some left cerebellar issues, maybe we have some altered right frontal lobe integration. What if you could utilize low-level laser to improve those areas of the brain to give them more nutrients, more oxygenation, and more capacity to be able to handle therapies and just life in general? That's a real possibility. It's a very likely possibility as well, too. That's where it becomes so important for you to be able to do a bedside neurological examination. Not only do we have neuronal cascades, but we also have different types of metabolic cascades that occur as a consequence of a concussion. And some of the theories out there are pointing to that these are neurocognitive deficits that actually occur from these neurometabolic cascades. Once again, right, we see how effective low-level laser can be for these. We want patients to be able to have this window where even though they may have to rest for a week or two to fully recover from their concussion, which hopefully they do, what if we could utilize low-level laser as an early intervention to accelerate this process? Instead of waiting days, weeks, maybe even months to have the brain recover on its own, what if you as a provider could accelerate this process? Well, the good news is you can. Now I have a question for you, and this may hit home for some of you who in the States and follow American football, and some of you may be over your head, but Tom Brady is one of the most coveted quarterbacks in the National Football League right now, and he plays for the Tampa Bay Buccaneers. Now, how much money would it cost the Buccaneers, or let's say Ronaldo, or let's say any famous footballer in Europe, how much money would it cost them to have that player out for a few months versus a few weeks? Okay, we're talking millions and millions and millions of dollars. And we could utilize a simple, effective modality like a laser to potentially increase that person's capacity to recover and to heal. And this is beautiful because these patients at some point are going to be a little bit relatively fragile to be able to handle maybe a little bit more intensive kinds of care. The beautiful part of that is there are so many ways to go about this. And that's why it's important to understand how impactful these therapies can be, but more importantly too, the underlying neurophysiological mechanisms behind this. Because it's not just the brain anymore. We know how important the gut is and how important this gut-brain and this brain-gut connection can be. And I love this study. This study was published in 2009 in the Journal of Neurotrauma. And what they specifically did is they induced traumatic brain injuries in rats. And now they didn't touch any other part, but what they did is they did mid-sagittal slices of the lumens of the rat's intestines. And as you can see on the top, that's what a normal GI mucosa should look like. That's your gut barrier inside your intestinal wall, where you have a large amount of increased surface area, good goblet cell formation. You have a large mucosal lining, which is essentially how your body protects yourself with your immune system. 70 to 80% of your immune system is found in your gut. It's this gut-associated lymphatic tissue that is so important for us to find pathogens, especially submucosal A, different types of pathogens. The problem with that is, and this is in rats, but we're getting closer to being able to extrapolate this with humans. Within 6 hours of a brain injury, once again, that has no effect directly to the gut, you see significant changes in this mucosal lining. You see changes in goblet cell formation. The mucosal lining is no longer as thick as it used to be. If these are the castle walls you use to control inflammation and alter gut absorption, and really at the end of the day, this is where 70 to 80% of your serotonin is produced as well. All of these things have secondary effects to the central nervous system. And these can be really impactful and really powerful for us because it's not just the brain or the gut. Once again, it's a yes and conversation. Now, we can get into a little bit more detail about what truly happens to a neuron with inflammation and trauma, but one of the biggest factors with this is that this affects ATP production via the mitochondria. You have different types of efflux of potassium and calcium influx into the cells. In some capacity, this could be controlled autophagy, but in a traumatic event, this is actually uncontrolled cell death. And so as we start losing neurons, well, this is the predicate for neurodegeneration, right? We're losing neurons faster than what we would like to be. And so this is really important for us because as we have discussed, we need to intervene as early as possible to promote neural stability in brains that have experienced trauma. And since we know this low-level laser therapy can positively affect mitochondrial function, this should be one of the first interventions that we should be giving athletes, post-auto accident cases, and anybody who's involved in some sort of traumatic event to the brain. They're going to be bedridden in the early days anyways. Why not give them a passive modality that can greatly accelerate their healing opportunities? Because one of the biggest factors that we want to avoid is glial priming. And this is a really big factor for us right now, especially as we look into neurodegeneration. These glia are essentially the resident macrophages of the brain, and they're stationary. But what they do is they have these really long, we'll call them tentacles. They have these really long projections that are always scanning and searching the surrounding environment to see if there are any pathogens, bacteria, viruses, inflammatory responses. Now, glia are your friend to a point, unless they become activated and they start forming into these different types of glial that are M1 activated that start taking out healthy cells. They start promoting different types of pro-inflammatory factors like glutamate, arachidonic acid, different types of cytokines like tumor necrosis factor alpha. You start having different types of activation through NF-kappa beta processes where now you just have this uncontrolled inflammatory process. And what does this do? This changes synaptic conduction. This changes in your mitochondrial function. This promotes excitotoxicity, imbalances of glutamate and GABA. We start getting this uncontrolled inflammatory response. Well, as a secondary consequence of that, we also see changes in the blood-brain barrier integrity. So now we have changes in not only gut tight junctions, these endothelial tight junctions that allow our gut to be able to be selectively permeable, but it also happens to the blood-brain barrier as well. And to be honest with you, if you were able to create a compound that could disrupt this blood-brain barrier, you would be a multi-billionaire, because every single pharmaceutical company in the world is trying to hack this blood-brain barrier without causing long-term damage to it to try and get drugs across the blood-brain barrier. Now, the problem with this is you also have secondary immune consequences as a result of this. Changes in not only inflammation, but immune functionality too. This changes different types of sympathetic and parasympathetic balances and vagal tone, which is really important for us. And as we find out too, once again, using low-level laser can be a very effective way to control neural inflammation, because you can put laser over the skull, you can put laser over the brain, you can put laser over the neck. All of these different areas can have secondary consequences as a result of you using this. And one of the biggest areas of research right now is looking at how low-level laser therapy can not only suppress pro-inflammatory markers and very, very aggressive ones like NF-kappa beta and tumor necrosis factor alpha, but we're looking to see if low-level laser can truly dampen microglial activity for long-term changes in the brain to halt neurodegenerative processes. And this is really exciting, because now we're getting into how we actually treat and rehabilitate concussions and brain injuries. Now, as you found out, and hopefully you knew this before, your brain is not binary. This is not a simple thing as, oh, we can do this and we'll get this outcome. Your brain is relatively complex. Now, that doesn't mean that it's this unknown landscape and we have no idea what to do with it, but it's really important for us to understand that inputs should match outputs. And as we discussed earlier, your sensory inputs should match motor outputs. Motor outputs should be equivalent to the sensory inputs. But there's a lot of central processing that occurs with this. And this is why diffuse axonal injury can be so impactful and so degradative to the progression of symptoms following a traumatic brain injury. If you have an injury in one area of the brain, it can cause secondary and subsequent injuries in other areas of the brain. This process is called diaskesis, meaning that if there's an area of the brain that's dependent on input from another area, and that area is no longer giving it the right information, that area of the brain can now struggle as a consequence. And you have this snowballing metabolic cascade, neurological cascade, neurophysiological cascade that results as a consequence of that. So we need to ask ourselves the question, how do we truly help patients update their software? And there are three fundamental tenets for this, and we've already discussed them, right? So fuel, different types of glucose or ketone formations can be so impactful for a recovering brain and for a healthy brain to be able to function. Now, this doesn't mean that we need to be using one or the other, because your body's always using a combination of all of the above, but this fuel mechanism is so important for us because this is regulated by the production of ATP and mitochondria, Krebs cycles, right? Different types of glycolytic events that maybe don't need ATP, but long-term energy production really does. This plays a role with oxygenation, right? So we talked about how correlations of different types of neural activity will have to correlate with increased oxygen uptake and increased vasodilation to get fuel and different types of nutrients to these neurons that can continue to be fired and wired. That's a problem with a concussion, especially if we don't correlate and really intervene on those issues early on. And then the last but not least is we have to activate the brain, right? We have to stimulate the brain, because this is such an important component of changing the brain. Is neurons that fire together will wire together, but the same is also true, right? If we try and learn how to play piano early in our lives, we don't play for decades afterwards, we're not going to be on the same trajectory as we would have been if we would have continued to play that instrument. Now, the problem is that over time, your brain is too efficient, and it will take different circuits and different neurons to adapt them to different processes. And so this happens with depression, right? We see the default mode network become very rampant and very aggressive in its firing, helping these individuals promote ruminating thoughts, which carry them. And it's this big positive feedback cycle with addiction as well, too. We want to be able to change the brain's integration, and we do this through these three mechanisms. But once again, we know so much more today than we did 20, 30, 40 years ago, and especially over the last 10, if not 20 years of research, we've realized that the redistribution of synapses, specifically using different areas of the brain to take over different functionalities of other areas of the brain, can be very impactful and very beneficial, right? Neurons that fire together will wire together. We want this to be for better and not for worse, right? We want this to promote more efficiency, more range of motion, more movement, more quality of life, not more pain, not more dizziness, not more headaches, right? Not more seizures if you're epileptic. So there are a lot of factors that go into this, and we're specifically talking about neuronal growth factors, right? So the big one in the center is brain-derived neurotrophic factor. The other one is nerve growth factor. And as you see, there are different mechanisms that play with this, right? Specific dietary uptake, physical exercise, different types of non-steroidal anti-inflammatories. I would even argue different types of anti-inflammatory diets, right? Contextual learning, different types of mechanisms to induce different formations of memory and cognitive processing. And the last one's transplanted neural stem cells. And so that's a little bit out of our context, but what I want you to realize and take away is that there are nerve growth factors that can have significant influences on our brain's ability to remold and reformulate itself. Well, interestingly enough, we now have evidence that low-level laser therapy can increase the metabolic capacity of neurons and stimulate anti-inflammatory, anti-apoptotic, and neurotrophic factors. It can also promote neurogenesis and synaptogenesis. Now, there are only two areas of the brain that we're aware of today where we can actually have true neurogenesis, and that's in the dentate gyrus of the hippocampus and the olfactory bulb of cranial nerve number 2. So it's really important, or cranial number 1, I'm sorry. It's really important for us to understand that using low-level laser can actually induce structural, neurological, and metabolic changes within the brain and the body. And this is why this can be so impactful for you as a provider. You can literally give your patient a non-invasive therapy to give them more fertile soil to replant seeds for growth and recovery. And that's one of the beautiful things about this, is because if you truly know how to assess and understand and diagnose a concussion, there's a very good chance that you can treat it. And this is where we start getting into the conversation about truly understanding what a quality bedside examination looks like. Per our discussion earlier in the day, you can have all the diagnostic imaging that you want, but if the patient doesn't have a tumor, an overt brain bleed, some venous malformation that came to bite them back and change things, then we're left with an examination. And we don't have diagnostics that are sensitive enough yet to be able to give us this information that would be taking the place of an actual bedside examination. So we need to understand how a quality bedside examination can set you apart from everybody else. You need to be able to understand the vestibular system. You need to be able to understand and look at the visual system and figure out how to truly and properly assess the proprioceptive system. These are the 3 friends that went to the same party that should be telling you the same story. But you can't forget about other areas of the brain, cortical regions, frontal lobe, parietal lobe, the olfactory lobe, right? The cerebellum. We need to understand the brainstem, right? These are these lower areas of the brain that we take for granted till we lose them. So this is respiration, these cardiovascular places, pneumotaxic areas of the brainstem. I mean, simple things like doing a cranial nerve exam can reveal a lot about the brainstem and how well it's actually integrating. But all of these things have an effect on each other. And this is once again why you have to be able to understand doing a quality bedside examination. There is nothing that will replace that. You'll also be able to get patients better who haven't gotten better before you. Because if you're a hammer, you're looking for a nail. And this is really important for us as providers because we're all receptor-based providers. No matter if you're an MD, a DO, a DC, a PT, we all rely on some sort of intervention to alter sensory integration to change motor outputs, right? Now, whether that's through a medication, a rehabilitative exercise, utilizing low-level laser, lights, sounds, supplements, it really doesn't matter. You're looking to change the output of the system that you're trying to intervene in. This is really important for us though, because if you're a hammer, you're looking for a nail, right? And so if you are a specific type of provider, and let's say somebody comes to you with neck pain, well, if you're a chiro, maybe you want to adjust. If you're a PT, maybe you want to give an exercise. If you're an MD, maybe you think that's a good time to give a prescription. And maybe if you're a surgeon, you want to see if they're a candidate for surgery. Now, there's nothing wrong with that thought process, but if the patient in front of you has tried those things before you, or if you're trying those things with them concurrently and you're not making headway, you have to critically think about what else might be going on. And this is why this is so important to understand the central mechanisms with the brain, is because we know how impactful visual rehabilitation can be on balance. This is no longer something as saying, oh, we need to work on balance mechanisms without the eyes. We need to get you to be stronger and have more range of motion. We know saccadic and pursuit eye movements can significantly impact your balance and your postural stability. Interestingly enough, too, we know vestibular rehabilitation can be very effective for patients with dizziness. This can also be really impactful for patients who are having neurocognitive deficits, because this vestibular system heavily feeds into these specific emotional centers with your amygdala, your hippocampus, and your entorhinal cortex. These are central stress response centers and emotional centers that become very skewed and very heavily hyper excitable after traumatic events, specifically dealing with concussions and brain injuries. We also know too that manual manipulations can be very effective in changing the brain as well. So the old tale with looking at Harvey Lillard, for those of you who don't know, the story with Harvey Lillard, I'd suggest looking it up. Now, whether you agree with it or not, or believe that some sort of manual therapy can change somebody's central processing and change hearing is still up to debate, right? We don't really know, but here's what I'm going to tell you is there may be some significant outcomes, especially for the providers who do manual therapies, that can occur centrally, and that might not make sense on the surface. But when you dig deep down and understand that you are changing central integration with the brain and body with manual therapies, some of these things may be a little bit more impactful and come to light. Maybe you see changes in vision. Maybe you see changes in cognitive processing. Now, I'm not saying that you can just give a manual therapy and hope for those changes, because I think that that would be malpractice. What I'm going to tell you is that there are things that we still don't yet understand about different types of therapies and how they centrally affect the brain. Now, one of the main tenets that you've seen throughout this entire thing is that during traumatic events, we see instability with neurons. Not only do we see instability from a metabolic standpoint, but we see instability from an energy production. We see instability with promotion of inflammation. We see instability with neuronal connections. We see instability with maintaining an electrochemical gradients via sodium potassium pumps. And this is where laser just once again reigns as one of the kings and the titans in the industry, because you can use laser as a low-level intervention to promote more neural stability, more neuroplasticity, to dampen inflammation, change pain levels, and change the hyperexcitability of these different types of neurons. Because when neurons are hyperexcitable, they're kind of like the wall outlet that's a little bit dicey, right? You plug in an outlet to that wall socket and maybe it works, but maybe it doesn't work. Or maybe that wall socket just completely blows up in front of you. This is the same thing that neurons can do too. And once you accelerate this neuronal process of losing neurons over time, well, this is what neurodegeneration really comes down to. So laser therapy, especially with using low-level laser therapy, can be such an impactful factor in being able to control inflammation, dampen oxidative stress, and the best part, it's non-invasive, it's safe, it's effective. Erchonia has put their reputation on the line by getting FDA approval for 18 of the 21 FDA-approved patents for low-level laser therapy. They did not need to do that. They did not need to go about and tell the world that they're FDA approved. You and I could go and put a red light in some sort of bulb and say, hey, this costs $20,000 and you can use it on the internet, and people would buy it. Nobody would know that it's ineffective until somebody would have a complaint or until the FDA would actually investigate it. This is why Erchonia is the king and the queen, we shall say, of their industries, because they've done the dirty work and they continue to pursue this. And currently right now, they're actually in pilot studies and investigating different types of neurodegeneration. They're looking into autism and seeing how these different conditions can change with the use of low-level laser therapy. Now, there's still a lot of research to be conducted, and that's one of the reasons why I'm aligned with Erchonia. Is I would agree with that. The best part about that is they're doing it with their own money, with their own time, with their own resources to try and show and try and find new ways to help people update their software and change their brains to change their lives. Now, we know low-level laser in animal models has been shown beneficial for brain injuries, optic nerve injuries, strokes, ALS, multiple sclerosis, Parkinson's, and Alzheimer's. And in human models, we've been showing that there have been similar changes for some of these different conditions: executive function, cognition, depression, emotional instability, and brain trauma. I'm excited for the future, because here's what I'm going to tell you: low-level laser has completely changed my practice. Low-level laser has changed my life, it's changed my patient's life, and I'm hoping that it's going to be able to change your life and your patient's life as well too. Low-level laser is effective because it works. And in my opinion, the future in treating the brain and the body and all these different types of mechanisms that we're all looking to try and optimize will be through the use of low-level laser therapy, accompanied together with different types of understandings about the brain, the body, looking into dietary interventions, and more importantly too, just truly understanding the person in front of you. Don't underestimate the power of realizing the person in front of you. It's more important to understand the person in front of you than the condition that they've been diagnosed with, because we all have beliefs and values. And at the end of the day, when it comes down to it, You can understand all of the neurochemistry, all of the neuroanatomy, and all of the neurology, and all of the neuropsychological, therapies out there. But if you don't connect with the person in front of you, you're missing on so many opportunities to help the person in front of you. And so what I'm going to do is I'm going to challenge you. Not only do you get to have cool toys in your office, not only do you get to help people, but you're really there to change the life of the individual in front of you. Don't underestimate how powerful and how impactful that can be. And if you're missing something, maybe it's time for you to take a deeper look into some of this stuff. So I want to thank everybody for joining me today. I'm so grateful to have this opportunity and this platform to be able to speak. I hope you learned something new today. I hope you came away with good questions and more information for you to kind of pursue your studies. More importantly, I want you to realize that the power is in your hands to be able to help these people. And I think that now is the best time possible to get involved in understanding the brain and the body more. So I would like to welcome any questions, and if there's anything that I can do to help people out to understanding this material more, I'm more than happy to have them reach out to me. So here's my contact information, and I know that there's going to be a little bit of follow-up after this as well too. So I want to once again thank everybody for joining me, and I hope you're able to walk away knowing a little bit more about the brain and body and the use of low-level laser therapies.
Brilliant. Thank you so much. That was very, very insightful. I know I definitely learned some new things, which was always every day's a school day, which is good. If anyone has got any questions, please put them in the chat on the right-hand side. If not, please feel free to either email myself or Dr. Erik, and we will get back to you. And like I say, you'll be seeing a lot more of Dr. Erik because he will be over in the UK early in 2022. So I don't think we have any questions, which is absolutely fine. I think you probably covered everything. So thank you for your time, and thank you everyone for joining, and we will see you in 2 weeks' time for the next webinar. Thank you, everyone. Thanks. Bye.